I wanted to ask, why aren't these items taught in schools rather than waiting until somebody's an adult? And then secondly, how may I help?
Oh, fantastic. I love that you want to help. We have a foundation. We do a lot of nonprofit work. We have like two little slogans. One is health is what happens between doctor visits. And when people realize that they are empowered, they take control of what they're doing. And the other is very simple, that behavior change is a miracle drug. And we're in control of it. You know, Peter called it being the CEO of your own health. One of the things I love about Matt is that you are such a wordsmith, you're so eloquent. You know, a lot of scientists have a hard time communicating and reaching people, and Matt has been able to bridge the science with the incredible communication gift. So we can do all that. Would love to work with you and anyone here who wants to reach millions of people who are suffering.
Thank you.
This is for Matt. Do you encounter or have you encountered patients that bring up the issue of restless leg syndrome and or neuropathy as it interrupts their sleep?
Restless leg syndrome, for those who aren't aware, you usually get sort of this creepy, crawly feeling in your legs. You have to massage them. It's horrific. Some people get it in the triceps too. It is one of the most undiagnosed sleep disorders out there, or at least I should say misdiagnosed. You can progressively walk up the medication pathway. You typically start with things like gabapentin or pregabalin. Pregabalin's a bit harder because it will typically make you a bit more groggy the next morning. Next level, you can go up to something like pramipixole, which actually helps tamp down some of the dopamine or modulate some of the dopamine circuits. The problem is you've got to be a bit careful because too much can lead you to become reward sensitive and risk taking. So you've got to be really careful with managing the patient. The final step up, because you can become resistant to that over time, is certain opioid-like medications. And of course, people are nervous about those. But those are the three tiers right now that typically we progress through to try to pharmacologically help with restless leg syndrome.